Thank you for having us. It looks like you guys have a great turnout here and had a great program. And it looks like I see faces from all over the state. So it's nice to have everybody gathered together. I thought it might be, since we're all women here, just to explain a little bit about our clinic. So we were all women, and then we hired my husband. So he was the only man on our payroll for a while, and now we have another male employee, but we're all women veterinarians. We do primarily cattle work. We normally preg test around 57,000 head a year between all of us. So we do a lot of cattle stuff, and it's something that we're very passionate about. So I wanted to get to know you a little bit as well, and just ask, because there might be people like Lori and I that are more involved in agriculture as far as a supportive role, but how many in here, by a show of hands, are directly involved in production agriculture? So pretty good, about over half. So that's great. How many in here have pulled the calf by themselves? So fewer, but still quite a few. Well, as women, we kind of have to learn different ways to do things. And so in my presentation, we're just going to go over some of the tricks and tips that I've learned over my 20 years of being a vet, as far as to make it easier to get calves out of cows. And we call it Calving 101. We got Stella through a grant that we applied for from the USDA. And that's helped us, because otherwise we couldn't have afforded to buy a $30,000 cow to do this. We'll just real briefly go over the beginning stages of calving. I do like to mention, if you think of something that I'm not bringing up, we can all learn from each other, and collectively we have a lot of experience in this room. So if you think of something that you'd like to share, please do, because I've learned some of the best tricks from people just in situations exactly like this. So they start by dilating the cervix. That might be when they're acting a little bit restless or a little bit off. And a woman's intuition really comes into play here. Sometimes women pick up on that a little bit sooner, especially if they're really used to being around the animals. Delivery of the calf, which is the main part of our presentation, and then delivery of the placenta, or cleaning, is actually also part of the stages of calving. So we ask our question of our producers a lot: when do you know to intervene? So sometimes the answer is, well, it depends on what I have going on that day. If I have a dentist appointment, I'll pull the calf before I leave or something, which I think that's a valid point. Like, you don't want to leave a cow in trouble. But a lot of times people will give heifers about an hour, 30 minutes to an hour of real pushing, and a cow longer. But it kind of depends on what they see. If you see something wrong right away, you'll intervene sooner. We're big fans of obviously restraining the cow so nobody gets hurt, but wearing protective gloves, because I had a colleague that she was pregnant at the time, and she was assisting in a delivery of a calf. It was actually a heifer that was aborting because of the bangs vaccine, and that's a live virus, so there was live bacteria. And so it was a real serious thing, since that causes abortions, and she was pregnant and things like that. So it's just a good idea to wear gloves. Cows have diseases that people can get. And sometimes, like, by the end, you wonder why you even did, because it's all a mess. But at least if you start at the beginning being clean. Cleaning up the back end of the cow, again, she'll be pooping all over you if it's a real complicated delivery. So just do the best you can. We always have our supplies on hand, lots of lube, which really helps, especially if the calf is dead. Sometimes things get dried out, so plenty of lube will help. Disinfectant to keep your chains or straps or whatever you're using nice and clean. So normal presentation, as everybody knows, is the calf is basically diving out, the soles are pointing down. So this is what you want to see, and you probably won't have to intervene, possibly if the calf is too big or the cow's real small. And that's what it looks like on the inside. This is just to remind me to talk to you about the shape of the pelvis of the cow, which you can actually see if you come up and we take the cover off of Stella. So if you look at it, the width is not the widest part. It's actually kind of a diagonal between about 45 degrees. So if you have a big calf trying to come out, sometimes if you rotate the calf, then you can get it to fit out, whereas otherwise it might get hip locked or even shoulder locked. And the ways to do that are, so say if you're pulling a calf and you've got the chains on, So sometimes I'll just, if the chains are on, I'll put my arms between the legs and use it as a lever to rotate it. You can do a half Nelson and you can grab the head and you can kind of rotate the whole calf, but try to rotate it so it's coming out at a 45 degree. If you're pulling by hand, you can cross the chains and that will roll it. So that's a good strategy to get a bigger calf out sometimes, where if you're worried about a hip lock or something. We do have some people that have us come and pelvic measure, so that's something you would do to heifers when you're selecting them. And you measure all of them and you make a spreadsheet, and the ones that have smaller pelvises you may cull, because those can give you trouble later. And we had a big ranch, they have 1,500 head, and we did that for a few years. And we used to do 3 or 4 C-sections for them every year, and now it's pretty sporadic that we do C-sections. So it does help if you have a lot of calving difficulties to kind of cull your herd that way. So now we'll get into some of the presentations and just the things that I do to help me out. So head back is one of the most common ones, and it can be back just to the side. It can be down between the legs, which is a super confusing one. Sometimes you'll reach in and you don't know what you're feeling. And that's where sometimes I get calls that people have a backwards calf. But a good way to know if a calf is coming frontwards or backwards is to grab the leg, and if it's a front leg, the first 2 joints will bend the same way. And if it's a back leg, the first joint bends one way and the other joint bends the opposite way. So make sure that you've got front legs or back legs so you know what you're dealing with and how you're gonna assess the situation. I harp on this to everybody, like make sure you've got 2 front legs, blah, blah, blah. And I have an embarrassing story. I was doing a dental on a horse and the rancher was pulling a calf and he said he was fine. And by the end he wasn't fine. So I went in to help him and he had the chains on already. And I didn't check anything. I thought that the head wasn't coming. So I put a head snare on. And we started pulling, and what happened was this leg was way in the back and this back leg was way up here. So he had the chains on a front leg and a back leg, and we pulled really hard, and I felt really bad because that was my cardinal rule, is always make sure you've got 2 front legs and 2 back legs. So it's just kind of like you need to go back to the principles all the time and never forget that. But when we got it on 2 front legs, the calf basically fell out. It was amazing. So there's another picture of a head back. This is one, I have such short arms, that one's almost impossible for me to get out if it's way back like that. So sometimes I'll have to do a C-section to get them out. I've tried laying the cow down so that the side that the head is back on is up, and it kind of makes all her guts fall away and it gives you a little bit more room. You can pump in some lube. That kind of makes everything float a little bit easier. And if you have a situation like that where you can barely reach, you grab a hold of anything you can grab a hold of. You grab onto an ear, you put your finger in their mouth and their nose. You can put your fingers in their eye sockets. Their eyeballs retract in, so it doesn't actually hurt anything. It is really gross, but it doesn't actually hurt them. And so grab onto anything and try to pull the head around. Once you start pulling, my theory is that sometimes the head goes back is because there's not enough room. So if you start pulling after you've got everything lined out, sometimes the head still keeps popping back. In a case like that, you can put a head snare on. So a head snare just goes around both ears, just kind of like a little halter. And it has to go on both ears, and it has to go in the mouth and be tightened up. And then you can pull on that too. But there's a place you could put this on a puller. You're not gonna jack the calf out by its head. You're gonna mainly pull on the legs, and you're only using this head snare to gently help the head come out as well. If you don't have a head snare, you can do the same thing with a chain. So just take a chain and put a really big loop in it. And then you do the same thing. You put it behind the ears and in the mouth. And then you can use that to help guide the head out. So people sometimes use twine. One thing I am not a fan of, but I know that some of my ranchers do it because they tell me about it, but I'm not a fan of putting a piece of twine around the lower jaw. So that's just a symphysis. And if you pull really hard on there, you'll break their jaw. So I can see why it would be very tempting to do. I will never do it. But if you do that for some reason, like just pull very, very gently on that because you don't want to break their jaw. You don't want to work so hard getting a calf out and then have it where it can't nurse. So be very careful of that because it is very tempting just to throw a little piece of twine around that. Okay, another picture of head back we already talked about. This is just showing grabbing the ice to pull it around, the little halter with the chain. So the next most common is a leg back. So you might see a cow just with one hoof out. You might not see anything. You reach in, you feel one leg and the head. So you check to make sure that it's a front leg. And then normally what I do is, so I'll reach up that leg and along the chest of the calf, and I'll find the other leg and I'll pull it up as best as I can. Now I have short arms, so I've had to come up with tricks to help me sometimes. And one of the tricks to make my arm seem longer is I'll take a chain, and I won't put a loop in it. I'll just kind of wad it up in my hand, and I'll reach in along the calf, and I'll throw this around the leg. And then I will bring the whole thing back outside, and now I'll put my loop on it. And then tighten that down. And now I can use that or have the rancher help me kind of pull the leg out, and I can use my hand to guide it. Because when you're pulling this leg up, you're going to want to cup your hand around the hoof so it doesn't puncture the uterus. So just pull it around that way, and you can use a chain to help you if your arms are short like mine. So there are, okay, there's shoulder flexion and carpal flexion. So shoulder flexion is when the shoulders clear back. That's the one where sometimes I have to use the chain because I can't reach, or sometimes I just can't reach. The other one is just when it's like the elbow is basically in the pelvis, and those are super easy to do. You just have to push the calf back in so you have enough room in the pelvis, and then you pull the foot around. But pushing the calf back in is really important for all these manipulations, whether it's a head back or a leg back or anything, because there's just not enough room in the pelvis if she's pushing on you. Oh, so that's another one of my props that I sometimes forget. So I learned this at a conference, that you can actually fold up a toilet plunger and put it in a cow, like so. And then you can use that to push against the calf. I even have, so women are actually at an advantage for this because we don't have as broad of shoulders. So it's really easy for me to put both arms in there and do manipulations. But men that have a really broad chest, like they physically can't get both hands in there. So I have a big guy for a rancher, and he learned about this at one of my conferences. So he put like a 6-foot broom handle on the end of this. So then there's a guy in the back like pushing the calf forward, and he's in there doing the manipulations. So it actually does work. You just, once it's inside there, you push on the calf's butt or shoulder or head or whatever you need to push on to push it forward. I bet you didn't think that I was going to bring out a toilet plunger for my presentation. So backwards is one of the frustrating ones, but it also can be pretty rewarding. So when you see a cow calving and there's feet sticking out, but the soles are pointed up, that's most of the time it's backwards. Sometimes it's upside down, but most of the time it's backwards. And cows can have calves backwards, but it's just not as aerodynamic for them to come out this way as for them to come out this way. So a lot of times they will need help, and you may intervene sooner if you see the soles of the feet pointing up. The only difference with pulling a calf backwards compared to pulling one frontwards is that the umbilical cord is going to break before the nose is out. So normally when you're pulling a calf, you want to pull with her contractions, nice and gentle, so that she's stretching as you're pulling and you're not tearing things. But When you see the umbilical cord coming out, you need to get after it because you don't want the calf to not have oxygen for an extended amount of time. So that's the only difference. The other thing when you're pulling a backwards calf, you need to make sure the tail is down so the tail can get caught on the pelvis of the cow, and then it's really hard to pull them that way. So make sure that the tail is down. Um, you also may have to rotate it just to fit those hips through the pelvis. You're not going to pull at the same angle because of the cannon bone is longer in the back. So you'll pull out a little bit more before you start pulling down. So there's little changes, but if you think about the anatomy of what's happening, it's pretty obvious. Upside down, so that's the other way that the soles of the feet may be pointing up. And this one can also be pretty confusing because you'll reach in and sometimes the head is sort of tucked underneath the pelvis and it's a little hard to tell what's going on. That's where you go back to your anatomy. The front limbs bend the same direction. And in my experience, most of the time if someone calls me with an upside down calf, I get up, get my clothes on, I make myself a cup of coffee, I drive slowly there, and by the time I get there, the calf is right side up. So a lot of times it just takes a little bit more time for that calf to roll, and the rancher will be embarrassed and be like, honestly, it wasn't like that when I called you and all that. But sometimes I'll get there and it truly is upside down. So there's a few different ways to deal with an upside down calf. What I normally do is I'll put chains on the front legs. I'll have the rancher start pulling by hand, and I'll put my arm in and I'll use it as a lever again to try to roll the calf in there. Some vets can roll the calf by themselves, but I can't. Um, People ask me all the time, well, how do you know which direction it's supposed to roll? It just seems like it wants to go one way more than the other. Like it's usually never directly upside down. It's one way or the other. So just go with whatever direction it wants to go. So I don't have the picture right here, but at the end I'll show you. So you can also put chains on if you need to roll a calf, and then take a branding iron or something with a loop in it, and you run the chains through that, and then you twist it up, and that will roll the calf. So there'll be another picture that we'll get to of that. Upside down and backwards, so the soles of the feet will actually be pointing down, and it can be super confusing too. But think about your anatomy, which ways the legs bend. And this one is a really tough one for me to get rolled. I've had to do C-sections on these ones before because it's just super hard to get rolled. You could try laying down the cow and trying to like pull it the wrong way. That is another way to do it. One thing about intervention that, say if someone calls me with a breech calf. So a breech calf is when both legs are up underneath it. So we sometimes call them a tail calf. You'll reach in and you'll just feel the tail is all. And so in those cases, before I even examine the cow, if the owner has told me that's what it is, then I'll do an epidural. And I like to train people to do epidurals because I think it's a really valuable tool to do. So I just use a simple dose, 5 cc's on a heifer, 6 on a cow. It's a low enough dose. If you need to repeat it, you can, and you're not going to mess anything up. We always use lidocaine. I'm not a fan of using alcohol because that could kill their tail. So if a cow is standing, you stand right behind her and you pump her tail, and you can see there's a place where it doesn't move and then a place where it moves. And where those places meet, that is where you do the epidural. So right here, and on a real cow, you can feel a joint. We can actually buy a tail that you can do this on, but it's like $1,000, so I'm not sure if we're gonna do it. So you go right on midline. I always have the bevel of the needle facing back. I find that spot and I put the needle in, and I do the hanging drop technique. So the epidural space is a negative space, so it's got negative pressure in there. So I just take my lidocaine and I put a drop of lidocaine in there, and then I advance the needle. So on a really fat cow, you'll bury this 1.5-inch needle, and on a small heifer or a skinny cow, probably about that much will be sticking out, like 3/4 of an inch or so. And when you get to the right spot, it will just suck in the fluid. Now, if you're off midline a little bit, you'll get blood in there, and then you just have to start over. And normally I use a new needle, so it's not contaminated with blood. So then you hook up your syringe. and just inject it, and it'll go in really easily because it's a negative space. So if anyone has more questions about that, we can do it a little bit more in detail after we're done. But it's a good thing to do, and it really helps the cow. Like, she doesn't stop having contractions. It only anesthetizes the caudal part of her, like her vagina and the part of her uterus. So she'll still push. She'll still help you have the calf, but she won't be squeezing on you quite as bad, which part of calving is just keeping yourself from getting so tired. Like, you're up a lot of hours and people get sick a lot. And so part of it is just kind of conserving energy as well. Oh, this is just a picture of where the needle is going. So there's also 2 spaces you could do it. And I just go with the space that you feel it the best. Like, don't worry about if you're in what caudal space, just wherever you feel it the best, that's where you should go. Right behind the sacrum there. So here's a picture of a breech. It shows you how it's inside the uterus. It shows someone pushing forward on the butt of the calf, and then they're grabbing the hock with the other hand and they're pulling it behind. So that's another thing. Unless it's a big cow and a small calf, I have a really hard time just grabbing the hock and moving it around. And so that's where I started using my chain trick as well. And once in a while, you do get a breech in a big cow with a small calf, but it seems like always it's a little tiny heifer with a huge calf, and there's not enough room to move everything around. So what I do is, so the legs are tucked up underneath it. I felt everything around. I wad up my chain in my hand, reach in, throw it over the leg, and then I have to reach on the other side, pull it back. Now, I never tighten this above the hock. For some reason, it seems like if I tighten the chain above the hock, I can't ever get it where I want to. So I scooch it down. Scooch is a technical term as well. And I tighten it on the leg. And now I've got a little bit of control of that leg. So normally I hand this to the rancher, and so I have it on the left leg. I would have him on my right. I would hand it to him. And then normally it's like, pull, don't pull, that kind of a thing. But finally, once I get to the hoof, I cut my hand under it, and I can use that to guide it out, because these ones, you're really at risk of puncturing the uterus. And you can kind of, actually, I think there might be a picture. Yeah, there's a picture where if you're just grabbing the hock and pulling it back, if you're using a lot of force doing that, that hoof is going to tear a hole in the uterus. Now, a hole in the uterus is not a death sentence if you find it right away and fix it. But if no one finds it, the cow normally dies. So after pulling a calf, I tell all of my ranchers that they need to reach in and make sure everything's normal and nothing's torn. So how are you going to know if it's abnormal? Well, if you reach in every time you pull a calf, pretty soon you're going to know what normal feels like. And then when you reach in and it's different, you're like, oh, that might be the rumen, or I think that's a kidney. Then you'll know that you tore a hole in the uterus. And I feel like a lot of these things we can teach ranchers to do, but probably fixing a hole in the uterus should be a vet. You can either go in and blindly stitch it, or you can prolapse the whole uterus and amputate it. You can go in like you would for a C-section and try to stitch it. There's a few ways to try to fix it, but it's kind of hard to explain. And I've torn uteruses before, like being in a hurry and trying to pull calves that were too big. The very first time I tore one, the rancher was really egging me on. He'd been hauling grain all day, which he shouldn't have told me, because he called me at like 10 o'clock at night. And this cow was calving, and she had a dead calf. And he's like, I think we can pull it. I'm like, I don't think we can pull it. Well, we pulled it, and we tore the uterus off of the cervix. So then we prolapsed it and amputated the uterus. And it worked out fine. But, in hindsight, we probably should have done a C-section. So this is showing pushing forward on the hock and then cupping that hoof to pull it back so you don't tear a hole in the uterus. 4 legs at one time. So that can be twins. They can come frontwards, backwards, both frontwards. But this is where it's critical to make sure that you have front legs and back legs, and to make sure that they belong to the same calf. So, and it seems silly, but when it's all in there and the legs, it's super complicated sometimes. So what I like to do is I pick one leg and I put a chain on it so that I don't get confused at what my first leg was. So it's got that, and then I reach up along that, along the chest, down the other wall, down the body wall, and down the other leg, and then I put the chain on the other one. So that's pretty much the only way that I can make sure that we're dealing with the same calf. And then you push everything else back in and pull it out. Because if you try to pull on two different legs of two different calves, it's not going to go well. Um, and then how do you pick which one? It just seems like one is more coming out than the other one, or there's more legs of it available or whatever. So I have had times when I've put my chain on the wrong leg and I couldn't find it. Like I remember specifically one where there was 3 legs up there. One was a back leg, 2 front legs. So I put the chain on the one front leg, and it wasn't the one for that calf. The one for that calf was kind of bent behind it. So I had to bring that one up. Or you may decide to pull the other calf. It just depends on how you decide to sort it out in there. 4 legs at one time can be a transverse where they're coming out sideways. And I have only had that happen one time, and it was actually transverse, but the back was coming out. And we ended up doing a C-section because there was just no room to manipulate anything. It was a huge red Angus cow. And once we got the first calf out, it was twins, and that's why there was so much room or so much stuff in there we couldn't move it around. But that's not very common. You can have 4 legs at a time when the back legs are up, and that doesn't happen very often. But when that happens, like say there's 4 legs up like that horse on the right, where the legs are kind of caught on the pelvis. So, and this has happened to me before, and I've had ranchers explain it to me before. So say you're pulling on a calf by the front legs, everything's all there, it's not even that big, blah, blah, blah. You're pulling, it's not coming, and then you hear a pop and it comes. So when that happens, I think that one of those legs was caught on the pelvis or both, and when you're doing that, you break the femur. So if that happens and the calf doesn't get up, you need to check for a broken leg because it happens really commonly. I was even at a basketball game one time, and so I'm hearing the people behind and the ranchers talking about how his son is such an idiot because he said he was pulling a calf frontwards, but it had a broken back leg, and that could never happen. And I didn't say anything, but I was thinking, yeah, it actually happens all the time. 4 legs at once is also a schistosomus reflexus. So has anyone in this room had one of these on their operations? Yep, there's a few. I feel like if you're ranching long enough, you're going to get one of these, and they're really disgusting. It's congenital. It's not genetic or anything. It's just a malformation where the midline doesn't close. So when the calf is being formed, the spine curls around because there's nothing to hold it back, and then all the guts are on the outside. So when a rancher calls me and says that he has twins and they're coming 4 legs all at one time, when he pulls on one set of legs, the other set comes too, I'm highly suspicious of this. And they're very hard to get out if they're coming that way. I almost always have to do a C-section, and then you've got a huge hole in the uterus. It takes a long time to sew back up, and it's kind of like maneuvering a table through a door or something. Like you really have to move it around to get it out there. If they're coming guts first, I've actually had the cow have them on her own before, or sometimes I can reach in with a wire and I can saw the calf in half and pull the pieces out. But either way, they're really hard to get out most of the time. 4 legs at once can be conjoined twins, and that happens fairly commonly. So in cases like that where you have conjoined twins, or sometimes a schistosomus, or the calf is just too big, you have to do a C-section. And some people do C-sections through the belly, but I think that most vets do them through the left flank. And so when I first started vetting in Harlow, the vet before me had pretty much trained people. He liked to do them laying down. They would have the cow tied up when they got there. Sometimes they would have it clipped for me. They were pretty well trained. But I guess I haven't been as good at training our clients because now a lot of times they don't have them ready for me and I have to help throw the cow down. So for years after I was a new vet, it was like I forgot my training and we would rope them and stretch them out and they'd step out of the rope. And then finally I was like, oh, in vet school, I learned how to cast a cow and we started doing that. And so I'm just gonna show you because it's way easier. I can pull a cow down by myself and it's just pressure points basically. So Lori's gonna help me put the ropes on and we'll just show you those pressure points. So this is just a nice soft rope, but I do it most of the time with a lariat rope because that's what I have. This is just a bowline around her neck, but I oftentimes just put the loop of the lariat rope. So you just hold on to this, basically the stem, and throw it over, and Lori will pass it under to me. And then this is making a half hitch. So you just make a half hitch over her back, like over her withers. And then you do the same thing. You hold on to this and throw it over to Lori. It is nice if you have a helper to do this for sure. And then do another half hitch there. And then one thing that I've learned now that I have more vets that I needed to explain, because one time Dr. Emily called and she was pulling and pulling and the cow wasn't going down. You have to move the half hitch part to the side so that when you pull, it'll make the knot be basically straight over her back. If you don't scooch it around and that this is just on the side, it won't put the pressure in the right spot. So as long as the pressure is down the middle, then you just pull and the cow will just sink down. And then have someone keep holding on to this, or you can tie it off to a fence or something to keep the pressure. And then you can tie up her legs to get her stretched out how you want her. But it's way better than any of the other ways that we have tried. Oh, there's another way to do it with ropes, like if you're worried about hurting their udder for dairy cows, but I've never done it that way since vet school. I've always just done it with the half hitch way. And then also you only need one person to pull on the rope, but it's nice if you have two, if someone helps you. Okay, so this is just the picture so I don't forget going over some of the tips, but so if the front leg or back leg, which way it bends, and then we did not talk about, so it's a good thing we have this, putting the chain on. So I have definitely just put the chain on like this if I'm pulling a calf out by hand. But if I want to pull a calf, and it's going to be a hard pull, then I'd put the chain on above the fetlock, which is this bottom joint, and then I'll do a half hitch around it. And what that does is it divides the pressure, the force of when you're pulling so that you're not going to break the leg. So it's a really good idea, like if you're going to use a puller or if you're going to have two people pulling, you should pull this way. Now, a lot of times if you're putting on the chains inside, just put one on inside and then pull it out enough to where you can see and then put your half hitch on, because it's really hard to do that when the legs are still inside the cow. We went over the head snare. We went over rotating. We didn't go over pulling one leg at a time, but it's the same idea as rotating. So if you think about the width of your shoulders, say you're going to sneak through a small area or something, like if you try to just go straight through, you're too wide, but if you turn, you can make yourself smaller. So if you're pulling a calf and you pull one shoulder forward and then you pull the other one through, it's going to make it smaller to fit through the space. So you can sometimes get a calf to come out by pulling on one leg first and then pulling on the other leg. Reviving a calf. So when I was growing up, my dad would lift the calf up and a whole bunch of fluid would come out and it was really dramatic. And I thought that's what you're supposed to do. But I'm only 5'4", so picking up a calf is not very easy for me to do. And I luckily learned in vet school that most of what comes out is just fluid from the stomach. So you're not really helping that much by lifting them up. And it's making them harder to breathe because all of their guts are pressing down on their diaphragm. So actually what you're supposed to do is tickle their nose, so that's a reflex. You can do acupuncture. There's an acupuncture site on their nose, like even if you have a 20 gauge inch and a half needle or an 18 gauge inch and a half needle or something to do acupuncture. Rubbing with towels helps, clearing their mouth out if they've got a lot of stuff in there. And then setting up sternally. So we were trained that if they can breathe out of both sides of their lungs, it's better. So normally they're just laying on their sides, struggling to breathe. And if you just set them up and get their legs underneath them. Oh, thanks. I have a cold, so it is really nice to have a microphone so I'm not yelling. So if you just set them up and have their legs underneath them, and then you kind of frog leg the back, then they're breathing out of both sides of their lungs. And you can also do coupage. So you basically just cup your hand and you kind of beat on them a little bit. And that helps to get them breathing too. And then rubbing them with towels and whatnot. Thank you. You're welcome. So that is better than lifting them up. I even have clients that have like hoists that they lift them up and things like that. But this is actually better. For medicine, I haven't been using Dopram a whole lot anymore. Like sometimes it'll make them breathe a lot better, and then they'll have kind of a reflex where they have respiratory depression. So I haven't been using that, but I will do some epinephrine if they're not really doing well, just to get them going once in a while. If it's a really hard pull or they have a swollen tongue, then I will give them dexamethasone to pull the swelling out of their tongue, so that they can nurse. A lot of times after we pull calves, I'll have the owner or milk out the cow and just tube the calf, because it is so critical for these calves to get colostrum. It just sets them up for the rest of their lives. So, maybe the cow is tired, maybe the calf's tired, and it's not going to get up and nurse in the time it should. You have everything caught anyways. It's just a really easy time to get the calf to get some colostrum. The other thing that I always do after we pull a calf is reach in the cow to make sure she's not hurt and give her oxytocin. So if you intervene in a calving, she's more likely to have a retained placenta. Again, you have her in the chute. Just give her 1 to 5 cc's of oxytocin. It's like $10 for a 100 ml bottle. So it's not costing you very much, and it may help her clean. It helps with milk letdown. I just don't really see any negative signs. One time I had a rancher, and she had this heifer that was just really mean. And she's like, I'm going to show her. So she gave her like 20 cc's of oxytocin. And she's like, she did like her calf after that. So I'm not condoning that, because that is a lot. But the other thing that I want us to try this calving season, we didn't really do it much last year, but there's that new product called Ferapese, and it's the maternal appeasing substance. And so possibly if you put some on the calf, you put some on the cow, maybe that will calm her down a little bit to want to claim her calf or like her calf a little more. It's FERAPPEASE, Ferapese, maternal appeasing substance. Does it? No, I don't think it has any iron in it. I have no idea what's in it really. It's probably magic juice, but I don't know. My poor husband, he has to try everything on his cows because we can't tell other people to use it. So we put it on all our calves when we wean them, and they did wean really great. So I don't know if it was that or if it was something else. But there's lots of studies that they've done on it about in the feedlots, reducing stress. Like if it smells like your mom is around, you're going to have less cortisol than if you're stressed out. So it is kind of an interesting product, and I'm not sure what its implications will be in the future, but we are going to try it this year for cows that won't take their calves. And then we're also have people that sedate cows all the time. It's like you knock the cow out a little bit, and by the time she wakes up, she thinks her calf is okay. So that's typically how we've been dealing them with it. But we have had some clients that have noticed that the cows that they sedate, it seems like their milk is sort of off. And so there might be some kind of another complication there that we don't know a lot about. So the therapies might be the way to go. We talked about uterine tears. We should talk about uterine torsion. So a lot of times the history is the cow's just been kind of acting off for a while, not really calving. And if you reach in, you either hit a wall like she's not dilated, or sometimes you'll reach in, but your hand kind of turns, or you can't reach the calf, or you can barely reach the calf. And you can rotate those just like rolling an upside down calf. When I was in vet school, we learned the plank and the flank technique. So it's basically you lay the cow down, like you cast the cow. Someone stands on a plank is what they taught us, but what I would do is just put my knee into the cow, and then you roll her over. So the idea is your knee is like stabilizing the calf, and you're rolling the cow like to untwist the uterus. So unfortunately, I'm a little bit spatially challenged, and we have rolled the cow the wrong way before, so then it's tighter. So then we have to roll her twice the other way. So I pretty much don't do that anymore, because sometimes you roll the cow and the cervix is still not dilated enough to actually get the calf out. But if you are out in the boonies and you don't have any other route, it is a way to try to untwist the uterus. Just think about like if a sock was twisted up and which way you'd have to untwist it before you roll the cow the wrong way. Uterine prolapse happens really commonly as well. So sometimes it's a really big calf and the cow is pushing, and then she just pushes her whole uterus out. Sometimes we don't know why it happens, but it is definitely an emergency. I had someone call me at 6 in the morning and they're like, well, we didn't want to get you up in the middle of the night. No, please get me up in the middle of the night. Like the sooner you put those in, the better. And that's why ranchers should be putting them in, because they're right there when they happen, and that's the best time to put them back in. So an epidural is of paramount importance when you're going to put these in. You do an epidural, you clean it up. If you do it right away, there's not that much to clean. You can kind of pull the placenta off if it is like got a lot of straw on it or whatever. And then we need to get, I've been saying this for years, we need to get a better visual of how to do this. But basically, there's the horns of the uterus. So there's the horn, there's two horns. There's the horn that the calf was in, and that one's big, like a calf was just in it. And then the other one is super tiny. So if you have a really big prolapse, like her uterus is hanging down by her hocks, both horns are going to be out. And I've found that I need to put the little horn back in first. So I find the hole where that is, I kind of push it back in, and then I take the big part and I start pushing it back in. So I normally put my hand into the uterus, like where the hole is, which I guess that's where we need our visual. You kind of, but if you're putting one in, you can tell where it is. And then if I need a rest, I can just rest my hand on the pelvis and it gives me a rest. And I know it seems silly, but it is a lot of weight and it's really hard on your back. The other thing that you can do is if you're in one of those maternity pens with rails, like the WW ones, you can get the grate from a barbecue grill or something like that, and you can set the uterus on that so that you're not bearing all of the weight yourself. If the cow is down, the only way to get a prolapse in basically is to pull her legs behind her. So if you pull her legs straight back like this, it looks really weird, but it tips the pelvis down just enough that it makes it easier to put it in. So since you're on the ground, usually I have a garbage bag that I lay here, I clean it all up, and then I start putting it back in. If there's someone else to give you a hand, so you can start pushing from one way, use flat hands so you're not tearing a hole in the uterus. They can kind of be working it in as well. And that's another reason for doing it sooner rather than later. So the longer it's out, the more blood that's getting stuck in there, the bigger it's getting, and also the more friable the tissue. So you might tear the uterus if you're doing that. If you do tear the uterus, it's not a big deal. You can stitch it up, but you need to have the supplies to do that or call someone to come and help you. So the other thing is once you get it back inside, your job is not done, because you know, like when you take your socks off and they're all wadded up, that's basically what it looks like. And if you leave it that way, it will have necrosis and it will die and she'll die. So what I do is I just reach in and I kind of pat it all into the right place. I have a friend that she'll pump in a gallon of water, which if you don't have a stomach pump, The way you can get water in or lube, and I actually learned this at one of these meetings and I do this all the time now, so I don't have to clean up my stomach pump. But so you can just take an OB sleeve, you can pour a gallon of water in here or a gallon of lube in here or whatever you want, and then you take it in, slide with your one arm, and you just push it all in with your other arm or have someone help you. So you can put water in there, and the weight of it will help the uterus go back down in its spot. I also learned this at a meeting. Well, my dad would always put a bottle of whiskey in there, and then it would weigh the uterus down, and then we'd have whiskey bottles after their uterus shrunk down, like laying around their pasture. So that's another way to do it too. Oh, this is the picture of where you would use the branding iron. So you've got the chains on the calf, and that's a torsion rod, but it's basically just got a circle on it like the end of a branding iron, so you could use a branding iron. You put it on there, and then that shows you putting like a stick through the other end, and you just turn it, but you could do the same thing with a branding iron. Oh, there's our picture of a uterine prolapse. Those buttons are the cotyledons, and so that's where the placenta attaches on a ruminant, and that's normal. And I guess I could kind of use this picture. So you can see up here, that's the cervix and then the uterus. And so a lot of times I'll put my hand kind of in this end, and it's going on the inside of the uterus. And so I'll be pushing it from the inside kind of, and then from the outside too, and just kind of keep working it back in. It seems like with a lot of calving things, the minute you think you're not going to get it is when you get it. And then also when you ask for help, like if you ask for someone to go put on gloves, then you get it. So those are things that have helped me in the past. Like I just completely give up and ask the rancher to help me. Go ahead. I'm a town kid. What are all those little purple things? Those are the cotyledons. That's where the placenta attaches on a ruminant. Yeah, they have a cotyledonary placenta. So that's one reason why it's so important for them to get colostrum, because their placenta is not attached everywhere like other species. So yeah, that's very common, but it's a very common question that people are like, I don't know, it looks like a pizza or something like that. Well, and when you look at the placenta, I mean, it kind of does look like a pepperoni pizza. What's for lunch? Metabolic disease. Okay, we talked about those things already. These are just the drugs that I use if you do have a retained placenta. Tubing a calf, one time people asked us about that. So, and we can actually buy a calf, I think, that you can tube too. Yeah, I asked Tom anyways. Sometimes we go over casting a broken leg, what to put in your calving kit. But we'll leave it open for questions now. This is one of my favorite vet calls ever. This lady called and she said that her cow was pulling the panel trailer around the pasture by her nose. So somehow the panel trailer was in the pasture and she got the hook of the safety chain caught in her nose, and she was just pulling it around the pasture. So we made a little krell out of the panels and I sedated her and we pulled it out. But I just was amazed, like, how does that even happen? Does anyone have any questions? Yes, in the back. Yeah. Yep. So I usually fix it first before I give it, but oxytocin, which I didn't mention, but it will help the uterus shrink down. So it's a really good idea to give it. I always give that to prolapses, definitely. Oh yeah, the sugar tricks works great. So normally just water with a little tiny bit of disinfectant. So if you put too much disinfectant on, it's going to be really irritating to the uterus and it's going to cause more damage. So either like weak tea or really light blue, something like that, but mostly just water. And then, so if you have one that's been out for a long time and you can't get it in because it's got all that edema in it, I always take sugar. I have sugar with me all the time. And if you sprinkle that on there, It's basically osmosis, right? So the water goes to where the higher concentration is, and it'll just start oozing out. Sometimes I'll take some brown gauze and I'll wrap it around there and squeeze it out even more, or I'll push my whole body against it and try to squeeze it out even more. But the sugar really does make a difference. There's not very many downsides to it besides it might make it a little bit more friable when you're trying to push it in. So that's why I don't do it on every single one, but on those ones that have a lot of edema, it's great. Right, yeah, you do worry about that. So that's why we try to keep the chains in buckets with disinfectant and things like that. But yeah, I mean, we start off clean and literally the cow does poop all over everything. Cows are not very clean. So you just have to do the best that you can. And then if you give oxytocin, they're going to expel most of that with their placenta and be okay. But uterine infections do happen and sometimes they get really sick with them. So in cases like that, we usually recommend like penicillin daily or Exceed or something like that that's really specific for going into their uterus, an antibiotic that penetrates their uterus. But a lot of times we can get them with oxytocin, or if they're farther along, we can use estromate or Lutalice or something to try to push that out of the uterus. Like I go to a dairy and they don't want to use antibiotics because they don't want to have to pull the milk. So a lot of cows with infections in their uterus. So I go there every 5 weeks so we can kind of follow a cow. And so say I go there and she's maybe had a calf 35 days ago and she's got an infection, but it's not that bad. So we'll give her Lutalice or Estromate, a prostaglandin, which will help squeeze some of that out. And probably 90% of the time when I go back the next month, she's cleaned up, she's all ready to go. But in that other 10% of the cases, we'll use antibiotics. So there are a lot of alternative therapies that you can use. And I used to do that all the time. And then I read some studies that it doesn't really make that much difference. And also sometimes like I'd put the bolus in and then she'd clean right away and there was the boluses laying there. So I kind of quit doing it except for if it was a prolapse and it was really gross and it was kind of like mucky in there so that it could sort of dissolve before the cow had a chance to just push it out. There are also, though, CMPK boluses, and I've started using them more. So I don't put them in her uterus, but if I have a bad calving or almost every prolapse, I'll give her these CMPK boluses orally. So that might be one reason why they might prolapse, is because of a deficiency of calcium. And then also calcium is so important to our muscles contracting, and the uterus has a lot of muscle in it, right, to shove the calf out. So if you give them CMPK, that might help some of that squeeze down. So I mean, probably when I started, I used hundreds of boluses every year, and now I use like 4 boluses a year. So it's not like it's a contraindication. I just got tired of looking at them spit out on the floor of the calving stall. Yeah, that's actually how I amputate them now. So the main thing about banding a prolapse, and I think people can do it. So say you can't get it in, and she's going to die because they will. Um, you put the band on around the cervix, but you have to cut open the uterus to make sure there's nothing in there. So a lot of times when a prolapse is that bad, they've pushed their guts into it, they've pushed their bladder into it. So obviously, if you put a band on all of those things, she's going to die. So if you are going to attempt to amputate a uterus with a band, before you tighten the band down, cut a hole in there, just make sure that there's nothing really important in there. And for whatever reason, I always put 2 bands on. I don't know why. It's probably like some superstitious thing, but and then you shove it all back in. You cut off the main part of the uterus, shove it all back in, and then I usually put a stitch in her vulva just to hold it all back in there. But they actually do quite well. Um, so the huge thing about a prolapse, which I forgot to mention, is most of the time, by the time we get there, probably 50% of the time, by the time we get there, the cow is dead because with everything hanging out and the vessels to her uterus at that time are about as big around as my finger. So if they tear, she's going to bleed out in minutes. And I know that it's minutes because one time my husband and I drove an hour to put in a prolapse, and she was out in the pasture, and we tell people not to move them because sometimes it scares them and blah, blah, blah. So the owner drove up to it. Thank goodness it was not me that drove up to it. The owner drove up to it. She got up and she got scared of her prolapse, and she started kicking it and bucking, and she tore the whole thing off. And so then we just watched for like 4 minutes, and then she finally died. So they can die. Also, once in a while, and this is so disheartening, but you get the whole thing pushed back in, and then she dies. Because if you think about it, those vessels are that big. If they've got a little tear in them, but everything's hanging out, there's a lot of pressure on it, right? And so when you put it back in and it all relaxes, then they bleed out. So that is a risk. You didn't do anything wrong. It just happens. No. I mean, I leave maybe that much tissue so the band isn't going to slip off or something. But yeah, I cut the main part of it off, and then I put it all back inside whatever's left, and just when I sew in prolapses, I just have a big huge needle, like a big S-curve needle, and we give these to our clients. But I start at the bottom, I go as far up, and you need to take a big bite, so it's not going to tear out. I usually can't make it clear to the top with my needle unless it's a small cow. And then I come out at the top right below the butthole. And then for whatever reason, I can usually make it all the way down on the other side. And so I go all the way down in one swoop on the other side, and then I just tie it at the bottom. It's called a purse string. And if you think about the top of a Crown Royal bag, that's basically what it is. And then you cinch it down so like maybe 1 or 2 fingers, just enough so she can pee. And then usually just leave it in. I've started doing them with absorbable suture because I've had a few calving calls where we sewed in a prolapse the year before with umbilical tape, and then the next year I get called out on a calving call, and oops, we'll just cut this stitch and then the calf will fall right out. So we've started using absorbable suture for that, unless it's a vaginal prolapse. So vaginal prolapses, they should be called because it will happen again. And they strain so much that if we sew in one of those, we use umbilical tape because they're just straining and straining. We're doing a survey in our practice in conjunction with Montana State University Extension. And we have a team of producers and our clinic and the extension agent from Sweetgrass County. And we are right now collecting surveys. So if you go onto the social data website and you click on current surveys, and then on the right-hand side, kind of in the middle of the page, there's an antibiotic survey for livestock producers. It takes less than 5 minutes to fill out, and we're asking questions like, well, we want to know some things just about people that are filling it out, like how many do they have sheep or cattle or goats or bison or whatnot. When do they start calving? Like maybe that makes a difference in your antibiotic use. What diseases do they treat? Mastitis, metritis, things in baby calves like joint ill, navel ill, pneumonia, foot rot, pink eye. We're just wanting to know what producers are treating with antibiotics. And then the group at MSU, the social data people, they are going to analyze all that information. And we're going to look through the scientific literature and find out what the best treatments are for those things. So that's why we're doing the survey. We don't want to spend a lot of time researching things that ranchers don't even care about. We want to find out what they're actually treating. So if there's some kind of an email link for this group, maybe we could share that with everybody so that we can get more people to fill it out. Oh, it's also on our Facebook page, which I did not know.